Welcome to Senior Moments, the podcast where we discuss all things senior, the good, the bad, and the utterly ridiculous parts of aging. Today I have with me Quincy Dyson and Haley Graham from Calaveras County Public Health. Welcome.
Welcome.
Thanks for having us today, Susan. My name's Haley. I'm a health education program manager at Calaveras County Public Health. I've been here since 2020 in December. I helped a lot with the COVID pandemic, and now that we're back into our regular programming with everything with public health, we've kind of been able to launch this opioid safety program, which is what we're here to talk about today.
Great.
Hi, I'm Quincy Dyson. I'm a community engagement coordinator here at Calaveras County Public Health. I've been with the public health since the year of 2020 also, and I work with the opioid safety also program.
Okay. So COVID hit and you were too scared to go anywhere else.
We were honestly working on cases a lot of times, so yeah,
Definitely.
It was pretty busy for us then.
Before we jump into the opioid training and information, I am curious about the COVID vaccine. Are you guys aware if we're going to have COVID vaccines available in the fall like last year?
Yeah, so we're looking at what the state is basically recommending from here on out, or from CDC recommendations as well. There are some talks about potentially doing annual COVID vaccine boosters, and so although that recommendation hasn't really been put out yet, we're waiting to hear more about that and possibly looping it in with flu vaccines, and if not, we'll just continue with our regularly scheduled flu, but recommend everyone stay up to date with their boosters as needed.
Okay. I do think I heard something about a new variant running around the country again, so maybe it's time.
Yeah, definitely.
All right. Well, with no further ado, let's talk about opioids.
Yeah, so basically with our program, our opioid safety program is really set on educating the public on opioid safety and prevention mechanisms. So looking at different ways of avoiding overdoses via opioids. That includes doing Narcan administration, utilizing fentanyl test strips, really looking at ways to reduce stigma as well. So starting to have conversations in the community about what opioids are, what different forms they take, and different ways to recognize the signs and symptoms of an overdose.
Okay, that sounds absolutely wonderful. And who should be aware of this? Who needs this information?
Honestly, everyone. So everyone is at risk for an opioid overdose. Basically, all of the people who are ever prescribed it or come in contact with it are often basically prone to having an overdose. So there's always mechanisms in place or some protocols just to be aware of. When you do have opioids maybe prescribed to you or a friend or family member. So we, like I was saying, always advise to keep Narcan around for that reason. Have these conversations with your family members. So for instance, if you have an older family member who may have fentanyl patches with them, this is a good time to have that conversation to make sure that they're taking their previous patches off, and when they do replace with a new one, so they don't accidentally put themselves in an overdose. And then if you do have people who are prescribed any opioids, just make sure that they do get Narcan from their pharmacist or their doctor as well, so that they have that in their home available for someone to use.
Okay, so if I had a prescription for Norco, for example, then the next time I go fill it, I can just ask my pharmacist to add Narcan to my prescription?
Yeah, so many of the pharmacists we've talked to locally also try to just naturally put it in as a prescription if they are ever prescribing any opioids. And so they'll a lot of times just pair it with Narcan with that opioid that's being prescribed. So that's a really helpful mechanism in place. But if that doesn't happen, it's always advised to start that conversation to see if there is a way for you to obtain it.
Okay, and if I do get it from my pharmacist, am I paying for it?
That really depends on your insurance. So a lot of times there are other free ways to get it. So if your insurance doesn't cover it, we also recommend contacting us at Public Health. And so we're looking at ways of increasing access to this Narcan, making some real big efforts to do public safety campaigns around it and do distribution pods. Also looking at putting in a vending machine that will basically dispense free Narcan to anyone in the public, which will hopefully sit in the Health and Human Services Agency building next to eligibility downstairs.
Okay, and would you have condoms and what else would be a good safety thing?
Condoms.
Oh, the fentanyl test strips, we have those in there as well.
Yeah, those face masks, COVID test kits as well, just basic hygiene kits too, so oral health kits and hopefully some deodorant, shampoo, conditioner, those kinds of things.
Oh, that'd be nice.
Hand sanitizer, yeah, just available items for families and individuals in the community to access. It should be open as long as the Health and Human Services doors are open, and so we'll do a public service announcement around that when that comes out.
All right, and are you going to put some pregnancy tests in there?
That would be a really good addition. It is in the list of things. However, we don't have funding around it currently, but hoping to add and kind of make various and meet those various needs in the community through these different items in the vending machine.
Oh, that sounds great. Yeah. So how are you going to, you came into the Calaveras Senior Provider Network and you gave us some training, which was wonderful. Everybody really enjoyed it. We learned a lot, and it was a fun class.
Thank you.
Are you going to put some more of those classes on?
Yes, our plan is to eventually train the communities, right? So right now we're looking at definitely putting parents and students together to get them to have their awareness of the fentanyl and what the community has been saying that they're seeing an increase with the youth of getting hold of this stuff. So our next step is to work exactly with the parents and the youth, because that is one of our newer populations and the ongoing generation of our population in our county. So that is very important to us. So we want to make sure that we address that coming out towards the community.
What if I'm a business? Can I call you and say, would you guys come and train my employees? Let's say I am, I guess I'm not going to name a business because I don't want them to take offense.
Yeah.
But, okay,
Yes.
I'm my own
Yes.
business. I'm going to call you. I've
Yes.
got 10 employees. I own a bar here in town, and I'd like my bartenders to get trained.
Definitely, that's it's funny you say that, because that was another one of our ideas of targeting our bars and places that serve alcohol and getting them to understand the importance of opioid overdose in our community. So that is one segment that we definitely will be targeting, along with opening the community. We're also thinking about working with our faith-based organizations
that's
also
a great
too.
idea.
So different aspects of the community is definitely what direction we're going into now.
Okay. And then, of course, you're going to hit the senior centers, right?
Correct.
Definitely. Yeah, that's a big one, I think, because we've definitely heard about stories about those fentanyl patches as well, and I know that is a common prescribed item, especially for the senior community. So we want to make sure that that education is available to everyone and those resources are available to everyone in those situations. So we will definitely be doing more outreach in that realm.
Definitely.
And expanding just to general community members, which definitely includes all of those centers. So look out for that in the next couple months. I think we'll have a few trainings set up throughout the county.
Yeah.
Okay. And then have you already gone through the firefighters and all the safety guys in the county?
So normally what I do as a community engagement coordinator, I go around and talk with all our first responders to make sure that their Narcan is not out of date, right?
Okay.
And so we go about and make sure that they're replaced, get any data of where we're seeing more of fentanyl is being, used, or a lot of overdose calls are happening. So we're trying to get a lot of data back to give that information to our community to see what hardest hit areas in our community. So we definitely work with our first responders on that aspect.
Okay. And how about veteran services?
They're also part of us too. We've been in communication with our veteran services to work together. A training will be coming up for them pretty soon also too, just for our vets. And like we said, everybody in our community is, we're trying to support and get them to understand the seriousness about fentanyl overdose.
Okay. There is a family caregiver workshop that's coming up. It's put on by Area 12 Agency on Aging. It's an 8-week course. I bet you guys would fit right in there. You
Right.
should go ahead and
Right.
see if they need some fentanyl training or Narcan training while they're
Yeah,
doing their class.
that's right up our alley. We just completed kind of a series of trainings for our Health and Human Services staff. So basically, social service workers, behavioral and mental health counselors, and case managers, and basically all staff who or are incorporated in the agency itself or offered the training. And with that, I think we did or trained over 100 individuals within the agency. So having those people who are in other people's homes working one-on-one with populations or people who do use drugs, it's really important to have this kind of knowledge and education around. So having just Narcan on you while in these situations is super helpful. So that was one of our big efforts this last year. And so additional to what we were doing with the schools. So basically now we're in a space where we've offered all of the public schools in Calaveras some Narcan trainings and we'll hope to have Narcan placed on every campus within the county in the next couple months. So that's a really exciting thing. It's been really well received by all of the schools, so it's been really nice to have that partnership and collaboration kind of in place and come together as a community to do this.
Okay. Now, when you say you've gone to the schools, are you talking about to the staff? Has all the training been to the staff, and now you're going to expand out to, say, maybe do the parent-teacher organization?
Correct.
Or okay.
Correct.
Exactly. Yep. That's kind of our next move. So we have, I think, trained maybe over 150 staff in total through all of the schools. And so basically there should be at least one individual who is trained on Narcan administration on each campus within Calaveras now. So that's super exciting. I know there's a lot of other counties who have been trying to do this effort as well. So it's nice to kind of be ahead of the game on this one.
You know, I have to say that I am really impressed with Calaveras County and the Health and Human Services Department. Ever since I started being more aware of what goes on in the county, I've just been really impressed that we've had such a forward-thinking department, and it's gone all the way back to Mary Zawicki.
Yeah.
You know, it's pretty amazing to me for a little rural county where, of course, we're always struggling for money and all that stuff. I think you guys are doing great.
That's so great to hear, yeah. And it's funny you touch on that money part.
Yeah.
You and I talk about this a lot, but this program's kind of been completely unfunded. A lot of the resources we have or pass out are either given to us free from the state. So that's how we obtain our Narcan through the Narcan distribution project that Department of Healthcare Services hosts. And then our education materials we've kind of all built in-house and the policies around those. So with that said, I think it's kind of taken off and been a little bit more successful than we expected it to be in the beginning. So it's nice to hear good feedback like that.
Yeah, it's funny, right? Because Haley, I said, what was the budget? She's like, there's no budget. Oh my God. Definitely. I also wanted to say that we offer these trainings in Spanish also too. So.
Oh, great.
Yeah,
So are you a Spanish speaker?
No, I'm not a Spanish speaker, but we have someone that can interpret it and help with the training.
That's great. I did have a neighbor quite a few years ago that was trying to pass a kidney stone, and they gave him a morphine patch, and he ended up dying in the middle of the night. But I really suspect that he had that morphine patch and it wasn't giving him the relief he thought it should, and he probably took something else, because I know in that household they had plenty of pain medication because of other things. So I think the point you made about making sure you're taking the patch off is really valid. And I also think it's really important as far as the stigma aspect, because it'd be really easy to have something on your arm and just forget you had it, and you're still in all this pain, so you go to your medicine cabinet and get the pill that they prescribed for you, take it at the right dose, all the time forgetting you already had this morphine patch on.
Exactly.
So,
and you hit on two things there. One being we always advise that if you are prescribed any opioids, to always talk to your doctor if you're still feeling that continuous pain. Before you increase any of your own prescription dosage, just please talk to your primary care provider about what you want to do, and never mix it with other substances. In addition to that, your second point with having that stigma reduction kind of available, I think the statistic is there is about 40% of Narcan or opioid overdoses have a bystander present. And so that means 40% of those overdoses could have been prevented if Narcan was available, or that stigma or that conversation had been had between those two individuals in that situation. So it's always good just to kind of be open-minded and have those conversations with others and listen to others if they are in a situation where opioids are prescribed, because this is actually a really helpful drug in terms of pain management. And so we don't want to reduce it to where it's not available. We just want to make sure it's being used safely in the community.
I agree. My mother was an alcoholic who committed suicide. So I feel that everybody has a chance to change their life right up until the moment they die. And that's, I heard about tough love over the years and all these other things, but I think for me the bottom line is it doesn't matter who the person is. As long as they're still taking a breath, they've got the opportunity to get their lives on track, if it happens to be that sort of a situation, and become a happy, healthy human being again. So I guess my message is don't ever give up, number one, on people, and two, that Narcan can give that second chance to people.
Definitely.
Yeah, and having those social connections is also super important. I mean, we have a myriad of really good resources in this community. Like you were saying, I think our Health and Human Services Agency has been really forward-thinking in providing a lot of these resources. And so always try and reach out. There's always someone here. I think behavioral health and mental health have set kind of a tone for wanting to support this community as well. And so use those resources if you feel that you need to. Those are available to you, and we always try to encourage people to reach out and talk to others. If having that one-on-one conversation helps, just have that connection for a moment. So definitely do that. Be that safe space for someone. Listen to others.
Absolutely.
And to touch on that point, some of the stories that we hear that through the trainings of saying, hey, Narcan saved my loved one's life is very, very important. Just to hear that, Sometimes you read a lot of articles, but to hear that person's voice and see the look on their faces like, oh, thank God that, someone was there to use Narcan to save my loved one's life is really important. That's
true, and I think that the fentanyl crisis is kind of like COVID. In the beginning, do you know anybody that had it? Do you know anybody that had it? No, I don't know anybody. Well, by the end,
right.
I had relatives on ventilators. Unfortunately, I didn't lose anybody due to COVID, but it got pretty serious.
Right.
Mm-hmm.
And I kind of think this is the same way. A couple of years ago, it would have been, do you know anybody? And it would have been no, but we had one woman that came to the training who lost a son to an opioid overdose.
Correct.
And I have a friend I went to high school with. She lost her son to an opioid overdose. Mm-hmm. And, I have another friend here in the community who lost his son to an opioid overdose. So I've gone from what's fentanyl to, yeah, I know people.
Mm-hmm. Exactly, yeah. And I think that's kind of part of the reduction of stigma as well, being able to be okay with having those conversations and not necessarily feeling ashamed around talking to others about this, because this is real, this is here in our community. And so just acknowledging that this is happening here, and being aware of the prevention mechanisms that are in place to kind of reduce the amount of deaths and harm that's being done in the community. So that's the fentanyl test strips as well. We definitely encourage using those just as a resource. Educate yourself on the 5-step process on how to read it. And just if you are taking any drugs, just test a little bit of that for fentanyl. And because we know that a lot of the drugs that are happening are being circulated around the county are often laced with fentanyl. It's a way that kind of increases the addictiveness of drugs. And so we always encourage just to make sure that you know what you're taking, be educated about what you're taking, and in order to do that, to make those informed decisions, those fentanyl test strips are super helpful.
So let's talk a little bit about statistics. How prevalent is the opioid use, the prescription opioid use in Calaveras County?
Yeah, so we often take data from the California Department of Public Health Skylab. They have this really great opioid overdose data kind of collection, and with that, there's heat maps. There's ways to filter out different data to see how opioids are impacting different zip codes within your communities. So I definitely encourage everyone to look at this, but within there, they basically are able to collect data that is reported. So although some of this data may be underreported in terms of what actually gets to the state, the data that we do have shows that there were over 35,000 prescriptions for opioids in 2021, I believe. That number may have increased within the last year. We don't have that data yet, so there is a lag there. But to note, there are around 47,000 residents in Calaveras County. Now, these prescription rates do include multiple prescriptions, so if one individual got multiple prescriptions, that is counted in that number, but that does show the significance of prescriptions that are circulating within this county. And so it's just, again, good to be aware of those who are around you who may be prescribed this, and having that Narcan on hand to be able to just be ready if anything happens.
Okay. One of the other things that came out on our training is that a lot of seniors have Pulse on their refrigerator. And we did have some short discussion about what does that actually mean. And for me, I might not want to have a stomach tube or be on a ventilator, but you know what, if I accidentally overdose on the opioid prescription I got from my doctor, I'd sure like you to come and help me. So,
Yeah.
so I think, is that something we should be telling seniors? Take a look at your pulse, make sure it actually reflects what you want.
Yeah, no, I definitely encourage that, and thank you for bringing that up. I think that's kind of a great way to circumvent basically those DNR requests and look at and have those conversations with what may be happening. And so that is everyone's personal decision. So make sure you are putting your wishes, and make sure you're clear with what you want on that pulse, and make sure that you're talking to any caregivers or anyone who is in your support group to make sure that they are clear on those requests as well, so you have someone to advocate for you.
I think that's a great idea. Mm-hmm. I know that I used to take care of a woman overnight. I stayed with her overnight. And she had a DNR, but I assured her daughter that if she just stopped breathing, I probably couldn't just stand there and not do anything. Mm-hmm. But her daughter lived next door, so I would have first of all called her right away, called 911, and then I guess I would make that decision. But it'd be really hard for me to just sit there and let somebody die on the floor in front of me.
Yeah, no, calling those first responders and having that connection and making sure that you're letting someone know so that they can be sure to take over and make those decisions is definitely encouraged as well.
Yeah.
And I think I look at it as from the youth perspective also, too, because we do have guardians that are older, grandparents that are raising their grandkids.
Oh, absolutely.
And so being able to have those youth and not being afraid to use the naloxone and getting them encouraged to make sure that they do something in that type of situation. So that is definitely, the pulse is definitely important to have on the refrigerator. But my main thing is just, making sure somebody does something.
Absolutely. So why don't we go through what's going to happen? I've come upon you and I decide that I think you've overdosed. Why did I decide that?
Yeah, so Q, do you want to go over the signs and symptoms?
Well, first, like I said, you identify the overdose, right? You would check, you would ask, shake, make a rubbing. You would rub the sternum and the inside, tap them. While you're doing this, you're also making a phone call 911. The main thing you're looking for is the breathing, right? Okay. If the person is not breathing, that's a telltale sign that it could be an overdose. You're also looking at the eyes. You're also looking at the fingertips, the lips, making sure that the lips are turned, the lips haven't changed colors, those type of things. But the main thing I try to get across is the breathing, right? Next thing, you administer the Narcan. So with that being said, with administering the Narcan, you can also eliminate, the overdose portion of it too, right? So in the meantime, our main focus is making sure that the person stays calm and making sure that the person is called 911. That's the main thing. But other than that, our main concerns is also taking notes, right? Okay. When you come upon somebody that's unresponsive or on the floor or some sort of seem like they're at an emergency situation, that's the main thing of just saying, hey, do those steps. Shouting, rubbing, calling 911, looking for breathing, administering the Narcan, and just making sure you're comfortable. So when first responders get there, you say, hey, I walked up on this individual at this time, I administered Narcan at this time, and give them some type of note. So that's our main focus.
I thought the suggestion of writing on the person's forehead was really great that we got from someone in the training.
Mm-hmm.
Because it's right there. It's not going to get blown away in the wind.
Right.
It's not going to go with one responder and then the person ends up with somebody else.
Right.
Or, it's like right there. Nobody's going to be able to miss it.
Totally.
Yeah, that was a great idea. And I think, too, like just kind of emphasizing the simpleness of having Narcan on you. Like, these are simple nasal plungers. You can basically do one or two of them pretty easily. There is a really great video. The California Department of Public Health has an overdose or Narcan administration video. It's a 12-minute video. Anyone can watch it. It's on YouTube. But I encourage everyone to go and look at that, because if you do have Narcan on you, it's a great just demonstration on checking signs and symptoms, looking to see if fingertips are blue and purple, checking for that breathing, the pulse, and then administering Narcan, doing rescue breathing if needed, and then putting them in a response or a recovery position afterwards while you're waiting on that emergency help. So it's a really good visual demonstration of how that works, and basically after that you should be considered trained and being able to carry Narcan on you.
Yep.
So what are the legal liabilities of administering Narcan to someone?
Yeah, so there is the Good Samaritan law, which basically is probably the most familiar of liability coverages that we have, but it essentially eliminates you from any liability if you are acting in good faith and in sense of an emergency. And so there are a few other Narcan or naloxone administration regulations within California that also protect individuals of that liability. So I encourage people to look those up if they are concerned about that. And so those are available on California's they have a legal webpage that you can kind of look through and filter through, and I can send those to you after this as well. But it's just a really good outline and is helpful of kind of alleviating people of that risk or that worry about the risk.
Okay. So one other thing that came up in the training was, I just love we have some very open and honest people in that group, and that's a good thing. But her comment was, well, I'd be pretty mad if I just decided I wanted to off myself and somebody came and gave me Narcan. So my response to that is going back to my mom and her suicide. Mm-hmm. She might have wanted to commit suicide in that moment, and she did. But, had somebody been able to reverse that process for her, I don't know. She may have gone on to live a happy and healthy life after that if she got the correct help that she needed. So I'm kind of the opinion, well, I'm not kind of, I am of the opinion that even somebody who started out to commit suicide, I'm still going to try to bring them around, because they could have changed their mind somewhere along the lane, and they might change their mind once they're back with us. So I don't think there's a real downside to it. If, as somebody said, they wake up and they're pissed, well, you can,
Right.
you can go and repeat this process when I'm not around.
Right.
But here you've got the opportunity to make a better decision.
Yeah, no, and I think that again, emphasizing acting in good faith and really just being there. I mean, if you come upon one of these situations, you don't necessarily know what the intent behind that situation was. And so if that may have been a situation where that accidentally happened and we don't necessarily know. So if you're acting with the information that you have at that moment and trying to do something good for the individual in front of you, then yeah, use the resources you have, and at least call emergency services, we ask, if you do not want to do that yourself.
Yeah. So we did have one person in the group that absolutely is adamant she's never going to administer Narcan, and that's her right. Mm-hmm. And it's, I guess I want to bring that up right now because while I would encourage everybody to carry Narcan and to use it if appropriate, if you choose not to, that is your right, and you shouldn't feel bad about that either.
Yeah.
Right.
And again, if that is your decision, again, we just ask that you call emergency services if you see someone in this situation, so that they are able to make informed decisions on the situation. And so that's a really important point to make. And so just know that there are alternate routes to take in that situation.
Okay. Now, this is a podcast, but it's going to be loaded twice, once as just an audio and once also with the video attached. So why don't we go through the Narcan training that you've got right in front of you, show us the Narcan, what it looks like, and go through a little explanation of that.
Okay. So in our training, we have the demonstration of the Narcan, which doesn't have any medication in it, right? So just shows how to use the Narcan, how to administrate it. So makes it real simple, easy. Here we have the fentanyl test strips. This is another portion that we talk about in the training. And what we do is we walk you through it with the water, just test to make sure that anything you may have is negative or positive. Totally, we bring something that is negative, right? Because I know sometimes in the training, people are like, what is this? I don't want to touch this and this and that, right? So I just say, hey, it's only aspirin, right? So, so we demonstrate that. We walk through that. The breathing mask, we also give those away during the training. We also have a quick start guide, so we walk through steps 1, 2, and 3. We make sure everyone is very comfortable with that aspect of it. We also have a quick start guide that we'll be handing out about overdose information with that. Then we also have the Narcan itself, and then after the training is completed, you get a box of Narcan, and then you're able to keep it with you at all times.
All right. So I do have it in my purse, and one thing I didn't think about, it does have, I believe it's 77 degrees is your optimal temperature for storing it.
Correct.
And then it did say excursions, you could go up to 104 degrees for a little while, which is really a good thing because I threw my purse in the back of my trunk and went into an event, and it was 105 out. So I didn't even think about the fact that I should be, considering the temperature outside. No, I think it was way less than 105 in the trunk, and it was in the shade, and it was a couple hours, so I'm, fine. I think I hit those parameters, but until I did it, I didn't even think about the fact that now I need to be aware where I'm leaving my purse.
Right.
Yeah, definitely. Just look at the recommendations. I think every box has the temperature ranges that are kind of preferred for having Narcan. Just note that the Narcan we distribute is the nasal spray version. There are a few other types of versions with syringes. However, this is probably the most accessible and easiest to use. And so with that, if you do have the nasal spray version of naloxone or Narcan, you were correct, the storing below 77 degrees Fahrenheit is kind of recommended. However, it is also recommended to not have it go over 104 degrees Fahrenheit in total. And if that's the case, we kind of ask to either dispose of it and get a new one, or I think that's basically all you need to do.
Yeah. Give us a call in public health where we replace it.
Yeah.
Okay. So do you recommend I replace the one that I already have, or do you think it's probably okay?
We can give you one.
Okay, I'll go
Because you've been trained.
Yeah.
Okay. Speaking of the training, if anyone out there that is listening to this podcast or watching the podcast, if you would like to watch the full training that we did for Calaveras Senior Providers Network, you can go to calaveraseniors.com. And the video is there, and we had a PowerPoint presentation, which you can also download those files, calaveraseniors.com. Now, are we done with Narcan?
Yeah, we are basically kind of in the phases of doing our Opioid Safety Coalition, so we wanted to kind of take this opportunity to talk about the opportunity for community members and anyone who may be part of organizations who are interested in opioid safety prevention mechanisms to attend or contact Quincy or I to attend one of our coalition meetings. They happen quarterly. They're basically meant to find activities and or promote activities that are around opioid safety prevention, substance use prevention at any age level. And so we're always open to having new members join and join in on these conversations because the more help the better. A lot of our efforts have been based on collaborative partnerships, and so we're hoping to make more of those along the way.
And what I like about the coalitions is it's an easy way for individuals in the community to get involved, right? A lot of times we don't know, we want to get involved, but we don't know how or what should we, so if you're passionate about something like this, definitely give us a call at Public Health and get you involved.
And what phone number am I going to call?
209-754-6460.
Okay, now say that again a little slower for us people like me.
209-754-6460.
Thank you. I don't write that fast, so, you got to do it for the slow people. All right, and then I saw something about the dental vans coming back.
Yeah, we have our oral health van that is coming to do sealants in the community, so I would definitely check out our oral health webpage and our social media page on Facebook. You can find us at Calaveras County Public Health. There's details on how to register for that event. It is, I think, available for a majority of age levels, but they're trying to hit the 5th grade and up, because that is probably the prime age group for getting these sealants. But again, there's more details on the Facebook page and webpage with this information. The Public Health Division has also released their Calaveras Health Assessment, which is a survey that we're trying to promote to everyone in the community. It's a great way to give feedback around the health in your community, the health that you have. A good way to provide input on maybe some more programs or activities you may like to see in the community. And so we are encouraging everyone to go ahead and take that. There is also the opportunity to win a $45 gift card if you take this survey, and so we're hoping to get that out. It'll be running through October 9th, and it will be utilized to support a health improvement plan that'll hopefully be out by next year.
All right. So if you're having a hard time finding a doctor, like you went on Medicare and you didn't have a regular physician before that, now you're trying to find a Medicare doctor and it's really tough. Those are the kinds of things that this survey is going to bring to the forefront and help us try to solve.
Yes, definitely. Thank you for mentioning that. There's definitely a deficit of information, and so this is a great way to provide all of that input that you have. It's a great opportunity to let us know what opportunities for improvement there are in this community, and so all of those challenges that you may be experiencing around health or healthcare services, we'd like to hear about it.
That's great. And then that is separate from the social isolation survey that is also being propagated right now.
Yes, so that is also a really good opportunity to talk about the social isolation survey and the information going around that. So that is open to anyone who is, I believe, 65 plus. And it is a way to gather information around basically any challenges or any opportunities for improvement around connecting individuals who may be experiencing social isolation. Especially over COVID, I think we felt a new shift in the way we connect with others. And so this is a great way to, say, hey, we may need more resources around technology to help support seniors, and a new way to communicate with each other. And so this is a great way to provide that input there. And I think Health and Human Services Agency Facebook page has more details on where to take that survey.
Okay, great. So what else do we need to talk about in regards to Calaveras Public Health today?
Oh, boy.
Oh.
Okay,
I think we covered a lot today.
I think we covered a lot today.
So maybe we should leave it there and say
Yes.
thank you for joining me today. I really appreciate it. I think this is a very important.
Thank you for the invite.
You're welcome.
Yes, thank you for having us, Susan. This was great.
Yeah.
I just think this is extremely important information to have out in our community. So thank you so much for joining me, and thank you everyone who's listening today. I look forward to having you join us on our next podcast.